The COVID-19 pandemic has become yet another issue that divides Americans.
You literally cannot mandate somebody to wear a mask knowing that that mask is killing people. It literally is killing people.
Amid a steep surge in coronavirus cases in multiple states, the country is still struggling to implement COVID-19 restrictions and simple safety measures like wearing masks. The implementation of health and safety guidelines has been a contentious and divisive process.
This is America! This is America!
We are not a communist nation.
This is not communist China!
These anti-mask activists in Florida are rallying against mandatory mask wearing and are promising 100 free meals for people who come to this restaurant without masks, even though Florida has become a coronavirus epicenter, with more daily COVID-19 cases reported than all of Europe combined. On July 12th, Florida broke the US record of new coronavirus cases in a single day, with 15,300 people testing positive.
The risks are very, very low. This is a virus that has a 99.6% recovery rate. This is a virus that is very well contained.
But the facts say otherwise. The coronavirus outbreak in the US is far from being contained. With over 3 million cases, the US is now suffering from a rapid rise in infections. And many states are halting or even reversing plans to reopen. The US Health Secretary, Alex Azar, said in late June,
"But the window is closing. We have to act, and people as individuals have to act responsibly. We need to social distance. We need to wear our face coverings if we're in settings where we can't social distance, particularly in these hot zones."
US health officials attribute the rise in cases to reopenings across the country, uneven use of masks, and increased travel. Yet many Americans are still rejecting orders that mandate mask wearing or restrict mobility.
Central disagreement is over how much the US government should do to help the American people survive this pandemic. What's odd about some Americans is that they distrust deeply the intervention of the government into public health. And there are many different aspects of this, and many different groups have different reasons for being distrustful of the government. But in this kind of emergency, these disagreements are becoming stumbling blocks for how the US responds.
But why are many Americans so adamantly resisting COVID-19 restrictions in the name of personal freedom? And why are so many US officials and governors still hesitant to impose restrictions and lockdowns? Imposing the CDC's guidelines of wearing masks or enforcing COVID-19 restrictions like banning rallies or religious gatherings is not an easy mission in a country where polarization is increasingly becoming a defining feature of American politics and media.
Tonight, we're focused on two major stories. First, we're going to call out anyone and everyone who's using this virus as a political weapon against the president. Sick, it's sad, but predictable.
The COVID-19 health crisis has divided the US since the early days of the pandemic. Back in February, President Trump said this about the COVID-19 outbreak.
"It's going to disappear. One day it's like a miracle. It will disappear."
But the virus did not disappear. And within a few weeks, the US became the epicenter of the pandemic with more cases than any other country in the world. Fast forward to April, and Trump was publicly voicing his support for protests, calling for an end to state lockdowns in opposition to governors who had instituted mobility restrictions. All three states that Trump called to be liberated were led by Democratic governors. The response to the COVID-19 outbreak has become political and even ideological, further dividing Americans. According to a July poll, although 62% of Americans say they wear masks at all times when they leave their homes, a breakdown of the stats reveals a 33-point partisan difference between Democrats, 78% of whom say they wear masks all the time, compared to 45% of Republicans. But a hyperpartisan divide in the United States was on display long before the virus. In 2018, the Pew Research Center found that nearly 8 in 10 Americans say that when it comes to important issues facing the country, most Republicans and Democratic voters not only disagree over plans and policies, but also cannot agree on basic facts. These disagreements came to a head yet again during the coronavirus pandemic, and according to health experts, the lack of a unified and timely response to the pandemic has affected the magnitude of its spread. According to estimates from modeling and projections done by Columbia University, about 36,000 fewer people would have died in the coronavirus outbreak if the United States had begun imposing social distancing measures 1 week earlier than it did in March. Another study estimates that if 80% of Americans wore masks, the COVID-19 infection rate would drop to 8% of its current rate.
The U.S. response to the pandemic has been very much driven at the state level. that we haven't really developed a national strategy that is uniformly applied across the country. Each state has developed their own. And as a result, we've seen a very uneven response across the United States.
But while a growing number of US states are now mandating the use of masks and face coverings, enforcing it is another matter altogether.
Put your hands off me.
Bro, you gotta wear a mask, bro.
This shit's over. 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 Yay!
You're coming close to me. You're coming close to me.
Back off! Threaten me again!
Since face masks became an official CDC recommendation in April, tension over whether to wear masks in public has been building. Trump had long refused to wear a mask or any such protection until recently reversing his stance. His initial response was blamed for emboldening many Republican state governors to block mandatory mask wearing, leaving no room for a coordinated national strategy.
In the US, what we're seeing is a patchwork of different rules and viewpoints that make one part of the US more susceptible to the virus than another. This is an advantage if you want to limit the power of the central government, but when you need the central government to provide aid and guidance to the people of the country, it's a stumbling block.
State governments in the US act like autonomous bodies. They have their own constitutions, their own Supreme Courts, and the governor of each state has the authority to make executive orders, allowing them to impose measures such as lockdowns. But even if a governor imposes a lockdown, which is within their authority, a state Supreme Court can overturn their decision. That happened in May when the Wisconsin Supreme Court, which has a conservative majority, struck down a stay-at-home order from the state's governor. The core challenge of implementing these orders is a perceived infringement of civil liberties. Many Americans regard the Constitution and the Bill of Rights with an almost religious reverence. The Constitution was written by the Founding Fathers to embody the vision of what America should be, and for many Americans that vision is being contested. Today, during a pandemic that is ravaging the country, a face mask or a stay-at-home order is not simply a matter of public health and safety. For some Americans, it represents a threat to what they stand for.